Hello, I'm Angela Sevilla, and I'm going to be doing the rest of the musculoskeletal exam on my mother here. So now, for this part of the assessment, the patient is supine, and we're going to be assessing the hips. So first is an inspection, so we're assessing for deformities, any skin changes, muscle bulk, or shortening, which is best known as supine. And then I'm also going to be palpating, and just for the sake of this exam again, I'm only going to be doing one side. I'm going to be palpating the hip joint line and the surrounding musculature. Next, I'm going to be assessing range of motion. I'm going to have her flex. So we're going to have you flex your leg up and then extend down. And then I'm going to have her just turn to your side. We're going to be assessing for abduction to adduction. So I'm going to have you raise your leg straight up and then down. Good. And then we're going to do internal and external rotation. So I'm going to have you bend your knee, and I want you to rotate your leg out and then back in. And it seems like everything is normal. And then I would also assess her strength with hip flexion and extension, abduction, adduction against resistance. Okay, you can go back on your back. Thank you. Next, I'm going to be assessing the knees. So first inspection, so assessing for any swelling, alignment, or deformities, and then I would palpate the joint line, the patella, and assess for warmth and the diffusion, which I don't note at all. And then next, we're going to be assessing range of motion. So I'm going to have you flex your knee and then extend it. Okay, and then I'm also palpating around this time as well. Lastly, some special tests to assess for MCLs, LCLs, ACLs, or PCL injuries, and also meniscus injuries. With the valgus and varus, I'm going to first do the lateral. So I'm going to extend her leg like so and just push against. Does that hurt at all? And then we're going to do medial. Does that hurt at all? So I don't know any MCL or LCL injuries. Next, I'm going to be doing the drawer test. So this is ACL and PCL. So I'm going to have you just bend your knee. I'm going to kind of put my weight. Does that hurt at all if I put weight there? For the drawer side, I would basically, for anterior, I would hold the back of her knee here and then pull like a drawer, and if that causes her pain or if there's any note of like disalignment, then that can indicate an ACL. And then the same thing, I would push from the front, that would maybe possibly indicate a PCL. And then Lockman's test is quite similar. I would just have her extend the leg, and then I would pull the tibia and fibula, or push or pull around the tibia and fibula. But the Drawers test is a little bit more accurate. And then the McMurray's test would evaluate the meniscus. Lastly, for ankle and foot, we're going to be assessing the range of motion here. So I would have her do plantar flexion, so push your foot down like a gas pedal, and then dorsiflexion, which she would bring her toes to her head, and then inversion and everversion. So then I would just have her rotate, and that's assessing all ranges of motion on her ankle and foot. And I don't know any, and I would also be palpating during this as well. And I don't feel any abnormalities or any crepitus. And then lastly, palpation. I'm going to be palpating the malleoli, the lateral malleoli, and then the medial malleoli. And then I'll also be palpating the Achilles tendon, which is on her heel, and then also the foot joints from the metatarsals and then toes. And I don't feel any deformities. And that is the end of the musculoskeletal exam. Thank you.